Hello there. When couples fail to conceive, the problem is frequently to the or with the male reproductive system. About a third of the cases reported in the world. Now, the good part of it is most of these causes can be prevented because there is as a result of sexually transmitted infections and lifestyles such as alcohol as well as drug abuse. In this video, I want to talk about infertility in humans. And to begin with, I would love to define what infertility is. In this case, we define infertility as the inability to conceive within 12 months of attempting, of course, of attempting. However, there are certain factors or certain causes or conditions that affects both males and females in terms of conceiving. Some of which are as follows. Number one, in females, as I begin with, in females, number one, females sometimes they may have damaged fallopian tubes. So if a female has damaged fallopian tube, the damaged fallopian tube will not allow both the egg and the sperm cells to fuse so that fertilization takes place there. As we know, fallopian tubes are the only tubes where fertilization takes place in a female. Away from this, females also have what we are calling ovulatory problems. Some of the females complain that they cannot ovulate in 2 weeks' time. They are able to ovulate after 3 weeks or 1 month or 3 months, 6 months, just like that. This also can lead to a female's infertility. Others, it is irregular ovulations, irregular cycles, where they are able to maybe have at least 2 or multiple cycles in a month. That can also lead to infertility in females. The other one is endometriosis. Now, endometriosis is a condition where the endometrial cells that normally line the uterus implant around the outside of the uterus or the ovaries. And once such a thing occurs in a female's body, it is going to cause internal bleeding in a female, internal bleeding coupled with pain. And through this internal bleeding and also pain that they experience, they are likely to have more chances of infertility. Away from this one, I would like us to look at other conditions that affects the uterus. Some of the additional conditions that affects the uterus includes the development or growth of the fibroids in the uterus as well as in the fallopian tube. The growth of fibroids in the uterus as well as in the fallopian tube can cause a female to be infertile. Now, what normally happens is a female might produce an egg, but it cannot reach and meet the sperm cells. As a result, it will just be discarded. It will just die a natural death within the fallopian tube without meeting the sperm. And this happens in most cases. Apart from that, we also need to understand that other causes of infertility in females includes medical conditions. Medical conditions such as diabetes, epilepsy, and also thyroid as well as bowel diseases. These are what we are calling medical conditions. If somebody is suffering from high levels of sugar, or they lack insulin, or the insulin they have cannot work out to lower the levels of sugars in their blood, it means that it's going to disturb the hormonal cycle in their body. As a result, there is no coordination between the brain and also the ovary, as well as the uterus. If such a thing occurs in a female definitely will not conceive a baby. Now, remember, recently I was talking about endometriosis. Sometimes a female can even have her egg fertilized. But as it comes to implantation, because of the endometrial cells which have surrounded or implanted themselves before the egg will not be implanted. As a result, it will be discarded in form of blood. And this is what we are calling menstruation or menstrual cycle. However, from this, there are also other lifestyle factors such as overweight, stress, poor eating habits, and also underweight, as well as smoking. We have heard a lot of people talk about insunko in local language, which is smoking through the nostrils. Now, when you sniff on those insunko, what normally happens is that they are going to destabilize, and also they will be blocking the coordination or the interaction between the hormonal in the hormonal system. And because of that, a female will find it difficult to conceive. Away from this, poor eating habits. Our bodies are like machines that needs nourishment, that needs health food, that needs energy to carry out daily activities. Now, because of that, some of the eating habits have contributed more to female infertility, in the sense that some families, of course, due to economic hardships or status in the society, they have faced for many years. As a result, they are finding it difficult to conceive. Apart from that, maybe I can talk about your stress. If you are happy, my friend there, or my sister, it means everything in your body will be excited. Even the hormones that are involved in copulation or in the ovulatory system, they are going to be excited. As a result, because of that, you are going to have excited eggs that are going to be popped out or to be ovulated, to meeting in an excited mood, to meeting the sperm cells in the fallopian tube. And once such a thing happens, then expect yourself to conceive without wasting time. The other one is aging. Many people don't realize that aging has contributed much to infertility in females. When a female is aging, her eggs are limited and they are depleting each and every day. Because of that, at the age of 35 to 40, females' fecundity reduces or decreases. Even the genetic normal eggs, they decrease. As a result, this brings about difficulties in conceiving. Now, sometimes a female can conceive in her late 40s. And sometimes babies that are born, sometimes they are not that, we can consider to be somehow, some, I'm not saying everybody, I'm saying some, they may have problems with their mentality, their mental growth. because their normal genetic normal cells have already collapsed or decreased, depleted. Above all, let me talk also or address the male folks, because we are talking about a couple, and because of the couple, I'm going also to address the male folk. In this case, let me address the male folk by looking at the conditions that may lead to male infertility. One of them is low sperm count or sperm of low quality. During copulation, a male may ejaculate, but the sperms might be of low quality. They have got no energy to go and penetrate or break the membrane and enter the egg cell to fertilize it. They can't. They move at a slow pace. There is no speed. Because of that, they contribute to lack of or the inability to conceive in females. So that's the reason why in the first place I said, or maybe I'm saying it for the first time, that you shouldn't put a blame on a female because they have failed to conceive within 12 months. Rather, we should take the blame. If you're a man, you should take a blame together with your spouse and sort out the problem together. The other one is lack of erection and also ejaculation. Sometimes the penis fails to harden. When it fails to harden, that is also, especially during copulation, it fails to harden. Every time you are about to copulate, it fails to harden. That means those are signs of infertility. Not only that, sometimes it can erect, but you fail to ejaculate. That is also a problem. It's a sign that you may be infertile as a man. Now, problems. The other things is having inflamed testicles or mumps. Sometimes, due to hormonal imbalance in your body or in the male's body, there is an imbalance to the testicles. As a result, they swell. That is when we say inflamed. They swell and they pain. So because of that, a man would fail to release healthy and also mature sperm cells. And even if they are released at some point, but I doubt if somebody in the pain would also want to copulate. So because of that, they might fail also to copulate because of the pain. As a result, they may contribute to infertility or lack of conceiving in a female. The other one is medical treatment. Medical treatment, certain drugs reduce the fertility in males. Radiotherapy or rather surgery. For example, surgery to do with hernia, surgery to do with undescended testicles, surgery also to do with twisted testicles. All these, they contribute to male infertility. Diabetes, age, and STIs are common conditions that are shared among couples that like conceiving or conceiving in their homes. So even males, when they are aging, the quality of the sperm cells also reduces. The genetically normal of the sperm cells reduces. There is no enough energy to cause a woman to conceive. As a result, a man becomes infertile as they are also aging, just like females become infertile. But the The advantage is that even if they are aging, the sperm cells will still be produced. But females, there is what we call menopause. Menopause, it is a stage in which a female can no longer produce any more eggs, as well as cannot conceive. But males, the production of spermatozoa is continuously, like rather than the oogenesis or the oocytes, the production of the oocytes in females. Now, life factors that affects females also affects the male folks, such as overweight, poor eating habits, smoking, alcohol, having a job that exposes you to radiations or chemicals. Those are some of the causes of infertility in males and also females. At this moment in time, I would like to thank you and also encourage you to share the video to all your friends so that they can also learn one or two things. If you have got questions about this video and also anything, please comment, and also make sure that you follow this page. Make sure that you subscribe to my YouTube channel for more videos of this nature. Next time when we meet, I am going to talk about the advantages and disadvantages of birth control. Until we meet next time, bye bye.